Madam President.
Senator from Michigan.
Madam President, as public servants, I have always thought it is our duty to serve with dignity, integrity, and fairness to the best of our abilities. No matter where you are from or how we got here, the citizens of our states have sent us to Washington with the hope that we will do what is best for them. We hold the public's trust, and that is something that should guide us in everything that we do. Last week, I was home in Michigan for the 4th of July, and my family and other Michiganders celebrated and honored those who had fought for our independence and those who continue to defend our sacred freedom. Our American democracy is rooted in the promise of freedom and equal opportunity for every American. Our resilient nation has persevered because of shared commitment to do what is right, even if we don't always agree on how to get there. While home last week, I had the opportunity to speak to many Michiganders and hear what was on their mind. And they had a whole range of topics on their mind, but the number one issue that I heard was about the proposed Republican health care bill. Some were angry, some were confused, but most were simply scared. They're scared for their children, they're scared for their spouses, they're scared for their aging parents, and many are scared about what this bill could mean for their own health and well-being. Mr. President, I'd like to highlight a few of the stories shared with me in recent days. Susan from Clawson, Michigan, shared her unfortunate story about when she fell on hard times, unexpectedly lost her small business, and with it, her income. Susan, despite of all of her hard work in the past, no longer had the resources to obtain private health insurance. During this time, and it was an extremely stressful time, she also discovered that she had an unidentified lump on her breast. Through some research and the help of friends, Susan was able to enroll in Medicaid and get the treatment for what she discovered was a very aggressive but treatable form of cancer. Without Medicaid, Susan may not have gotten the treatment that she needed and may have lost her life. Nobody takes pleasure in sharing such deeply personal stories, but Susan wants to be sure that anyone who finds themselves in such a difficult position has the support that she had. And I appreciate her bravery in beating cancer and her willingness to share this very personal experience. Elena from Southfield, Michigan, shared that she was diagnosed with a rare tumor almost a year ago. Elena serves as a minister of music in her church in downtown Detroit and enjoys working with children through various local programs. Elena works part-time, and her husband works full-time, often 70 hours per week, but neither have health care benefits through their employers. Elena and her husband were able to obtain coverage through the ACA Marketplace, a plan that she would not have been able to purchase without the Affordable Care Act. Elena is rightfully terrified by the Republican plan and said that she would probably be dead without the affordable coverage that she received under the Affordable Care Act, and leaving her loving husband and her 5-year-old daughter behind. Matt from Waterford was unable to get health insurance before the ACA due to 2 pre-existing conditions. After obtaining health care through the Affordable Care Act, he discovered one of his pre-existing conditions had led to cancer in his digestive tract. Matt is convinced that the ACA literally saved his life and that he would not have been able to afford the care that he needs otherwise. Mr. President, hearing the stories of Matt and Susan and Elena and countless other Michiganders like them, I feel the need to remind this body that these individuals are our neighbors. They are husbands and wives and fathers and mothers. Illnesses or emergencies can happen to anyone. Ministers get sick. Students get sick. Small business owners get sick. Matt didn't choose to be born with a pre-existing condition. Susan didn't ask for breast cancer. And Elena's tumor could have been on any one of us. Mr. President, last week we honored our country's fight for independence, our nation's brave founders, and all who have sacrificed to build our nation by working towards a more perfect union to ensure America is the land of opportunity for all. The health care bill Republicans have written goes against the very values that we honor and that we cherish. It does not bring us closer to opportunity for all. When the nonpartisan Congressional Budget Office concludes that the Republican bill will leave millions of people uninsured, that should send a strong signal to all of us that we need to go back to the drawing board. About an hour ago, my Republican colleagues released additional last-minute changes to their health care bill intended to win over a few more votes within their party. Changes that were drafted behind closed doors and without input from the American public, the very people that we represent. In their rush to get this bill done quickly, my colleagues have not fully considered how this proposal will impact their constituents. Healthcare stakeholders and our nation's insurers have told Republicans this latest change will still cause premiums for older Americans and those with pre-existing conditions to skyrocket. It will still increase the number of Americans without health insurance by millions. We should be working on bipartisan legislation that will truly improve our healthcare system by increasing insurance coverage while bringing down cost, not forcing a vote next week on legislation that is seriously flawed. I ask my Republican colleagues to listen to their fellow Americans, Americans who are scared of what this bill will mean for them and for their families. I ask my Republican colleagues to listen to the people calling their office every single day and even traveling here to Washington, D.C. to speak out against this bill. I ask my colleagues to listen to the independent experts and healthcare stakeholders that have said in no uncertain terms that this bill will cost millions of people their health insurance and could cost thousands of Americans their very lives. I ask my colleagues to remember why they came to Washington in the first place. I ask my colleagues to step back and ask themselves some tough questions. Will this bill help people or will it hurt people? What will this bill mean for rural hospitals in their state, for life-saving addiction treatment centers, for preventative care that saves lives and taxpayer dollars? Does this bill hold true to the important American values of fairness, freedom, and equal opportunity for all? If the answer to any of these questions is no, we should scrap this bill, start over, and work together in a bipartisan way to bring down health care costs and improve the quality of care available to every American, no matter who they are or where they live. Thank you, Mr. President.